All right, and we're live now for the first time, the ROI Online podcast, interviewing Dr. Kris Wusterhausen of the Resurge Clinic. Dr. Kris, welcome to our first live stream.
All right, we're pulling it off. I like it.
Yeah, right now we're broadcasting on our YouTube channel and our Periscope channel. And later we'll be adding more channels as we get all of those set up. But really appreciate you being here and being a guinea pig. So, which is kind of a great segue into these conversations because when we've been having some conversations over the peptides and how other providers can consider actually adding those into their practice. And the
Right.
way that you got started was on you as a guinea pig. So,
hmm
so give us, for the folks that are just listening to this episode first, just give us again a little background about your journey from the chubby doctor who had to get his own act together to feel like he had the authority and have the
hmm
conviction to coach his clients to where you are now.
Sure. So I was around mid 30s, 34, 35. I had slowly started gaining weight, even though I was running daily, 4 or 5 miles. I thought that was the way to stay healthy. But continued to gain weight. My lab parameters continued to look worse every few months. I would check them, and my cholesterol panel was high. I was pre-diabetic. I was, borderline hypertensive. Just everything was trending in the wrong direction. And one day I kind of looked in the mirror, as I've told you before, and I realized that how in the world can I tell people what to do if they're going to look at me and go, "What are you doing?" And, someone, I don't know how I did it. I checked my testosterone level. I really didn't check many testosterone level back in that day. And I checked it and it was very low. So then I kind of leaned on some, fellow providers, and they put me on some testosterone gels, and nothing really seemed to happen. And even in my own practice, when I was doing testosterone replacement, we really just aren't trained in medical school how to replace hormones correctly, in my opinion, unless things have changed dramatically, and I don't think they have. So after a few failures, just basically frustration in my own practice, I bit the bullet and I went and decided to get a lot of extra training. I actually worked for a few years for a company called Synergenics, which is a age management medicine company. Got a lot of training from them. Didn't agree with everything, how they did it as I got more experience. And then eventually 10 or 11 years ago, kind of branched off and decided to kind of do what I felt was the best medicine that I could perform for my patients. And that's kind of what started me into hormone replacement. Still actively do that in my practice, huge believer. And then just, every year or so, it seems like we add something new to our practice. And ultimately, about 4 or 5 years ago, Ryan Smith from TaylorMade roamed, who's the vice president of TaylorMade, roamed in my practice, cold called on me, talked to me about peptides. I was just enthused about them and started implementing them into my practice on my near and dear patients and myself, and just really saw great results. And so we've just been adding more and more to our practice since then.
So now that your practice, you got out of general being a GP or your typical practice, and you've gone into more of a private pay situation. Say that three times, but but now your practice has a lot of other therapies and treatments. Correct?
Correct. Yeah, we do a lot of different things. We of course do concierge medicine, so that is still primary care medicine, but it's much more in a preventative nature. It's also, I think all of us kind of like concierge services if we can get them. My bank gives us concierge services. It's amazing. If we have a deposit, they come pick it up if we ask them to. So, it's kind of like that with primary care. If I say your appointment's at 10, it's at 10, get you in, get you out, take care of the problem, but also really looking at prevention. I mean, it's just so important for especially men our age to really look at much more than just a kidney, liver, blood sugar, cholesterol panel. It's just so much more than that. And your traditional FPs, just for the most part, I don't want to lump everybody in this, and they're all doing the best they can. They just have very limited time, and they're fighting under the insurance constraints. And the way I look at it is I don't work for an insurance company. When I was doing traditional family practice, I did. I worked for United. I worked for Blue Cross Blue Shield. I did what they said. I had to. It was the only way you can make things happen. They tell me if I can get an MRI or a CAT scan, not me telling them. My patients now see the value in paying a cash price for their services. We, of course, have a full aesthetic services. We do laser hair. We do injectables. We do hydrofacials. We do sculpting with sculpture, and also have the Icon laser resurfacing machine. We do PRP services, O shots for the ladies, P shots for the guys. We have a personal training gym in the back. We're really, that's one thing that's really grown in our practice is our personal training. We have a personal trainer here 4 days a week who is actually a chiropractor who decided he didn't want to continue down that path, but is an awesome personal trainer because he understands the body like hardly any other trainer does. We've added ozone therapy to our practice in the last few months. So we have a lot of great things going on here, in my opinion.
So today you wanted to kind of talk about the ozone therapy and what else are you combining with that? That was very interesting what you were telling me.
Yeah, so luckily one of my customers actually is a part owner in this company called All Core 360, and it's a piece of exercise equipment, and it's 10 minutes. It literally takes 10 minutes to do it, and it's not meant as your sole. I don't know if you remember back in the day in the American Airlines back pocket, they used to have this weird looking contraption that you supposedly rode for 4 minutes and it gave you the exercise of like 60 minutes. I always say it's not a gimmick like that. This is 10 minutes, but the name really says it all Core 360. You basically sit in this thing. I joke, but it feels like you're strapping into a roller coaster. And we set you back at a certain angle. You decrease the angle as you get better at it, but it causes you to use your complete core as you're turning in a 360-degree circle. You go 5 times clockwise, 5 times counterclockwise. And it was really first started for like stroke victims, maybe diabetic neuropathy patients who just can't simply work out. It's too much for them. This is a way they could keep their core strong because our core is so important for our balance, especially as we age. And so it's great for the senior patients. And that's where we're really hoping to get it out there marketing wise is to our senior patients. And we just added it in the last 2 weeks. But it also is really good we're finding out that our customers who work out at our gym are liking it kind of as a finisher. Instead of going over there and doing 50 crunches, we're throwing them on the All Core 360 for 10 minutes. And man, talk about your abs being worked out. And so we're just really excited about that. And we did, like we mentioned earlier, we added the Hocket, which is an ozone infrared sauna. And ozone is O3 and oxygen is O2. So it's basically a super saturated oxygen molecule. But the one thing that I find that most people, they think of ozone as bad because they've always heard ozone alert. And so they hear ozone, they think ozone is bad. That's not true. The story behind that is actually what's in our atmosphere that's bad is high levels of nitrogen. But it's from what I understand, the Weather Service has a really hard time measuring that. But ozone is very easy to measure, and they both go up together. So when they say ozone alert, it's really a nitrogen alert, but that's how they measure it is through ozone. So it gives some of my customers this perception that ozone is toxic. But the truth is ozone, there's not a lot that can live in ozone. And that's what's really cool about it. Some doctors actually IV ozone. I've actually been trained in that. We haven't implemented in our practice yet, but where you actually pull your blood out, it gets ozonated, goes back into your body. Basically, if you had bacteria, fungus, yeast, viruses, you can help deplete those things in your blood and then it goes back in. It's been used in Europe extensively for cancer patients, autoimmune patients, just patients that want more energy and vitality and anti-aging. And so other people have little ozone machines where they just fill it up into a syringe. They actually insert it into their ears, into their nose, rectally, believe it or not, vaginally, for vaginal disorders. So we actually settled on the ozone sauna because it made the most sense for me. I don't know that I'm really ready to spend the time it takes to IV ozone. I don't think there's a huge advantage to that over the sauna. So this basically, you sit in it, your head sticks out. It's infrared, so it's very warm. We try to get it as hot as we can, and it basically, the ozone then sits on the skin, and then over the next 4 to 5 hours, the ozone will basically absorb through the skin. So instead of IVing it, we're getting it transdermal. So it's much easier to do. It's actually very pleasant. People find it to be a relaxing thing versus a needle in your arm and having to sit there for 2.5 hours while your blood is pulled out and pumped back in. Much more cost effective as well. So we just have been thinking lately, as we've been getting more and more comfortable with it, that it's a natural combination, the ozone and the All-Core 360, for some of my clients that may not want some of the more invasive type procedures that we do here at the facility. We're just always trying to find something that we believe in, that we know works, that will fit a patient population, because not everyone wants to do the same thing and not everyone needs to do the same thing.
So how long do you need to sit in that thing to be the sauna for the ozone?
Yeah, it's 20 minutes, and so it doesn't take long at all. We typically recommend that most patients at least come twice a week, at least for 10 to 15 treatments. If you're just going to start once a month, it's not probably going to do a whole lot for you. It's a pretty amazing detoxification. We've actually shown patients how they'll go in, and in the bottom, you will actually see, clusters, like black clusters of different things that's detoxing out of your feet. And it's pretty amazing. It's not like those things that you put on your feet. I remember those foot baths or whatever, because your feet just sit on stainless steel props, but it's really a pretty amazing thing. I actually found the machine a few years ago and wasn't a huge believer in it at first. I had to be converted over. And so I'm lucky enough to have got to know the inventor and owner of the company really well, who is out of China, a South African named Andre out of China. And he's a really brilliant guy. And they actually let me start using it myself because there was one here in town, and I used it for a couple of months and really, started to see the difference it makes in people's lives. And so I'm a huge believer in ozone. I've gone out and trained in California on ozone. And so we just plan to keep on, expanding our ozone services. But this is kind of where we decided to start. We actually, believe it or not, had a lot of patients asking for this. So kind of is what pushed me into it, was a handful of patients.
So, and it's not just, so I'm still not clear exactly what it's doing. It's cleaning my blood. It's, what's it doing?
Yeah. So basically think of it as detoxification, as, we always had to be the bad part about United States is you have to be careful on what you say and because we can't make any promises with ozone in the United States. But a lot of people have actually been using it actually for viral treatments. I think there's a virus out right now that a lot of people are concerned about. We certainly can't say it's a treatment for that, but if you're boosting the immune system, if you're trying to lower the body of viral loads, then that's a natural spot where you can absolutely use it as well. Basically, how I like to tell patients about it is ozone is a product that you can actually drink it. You can make ozone water. You can actually clean things with ozone. Ozone is just a natural killer, but it's safe for our body. That's the cool thing about it. And so, do you remember when Trump misspoke and talked about the Lysol into the veins and soaking in bleach, I think is what he was saying?
The disinfectant.
Yeah, when I researched that, for the best I can tell, what actually he was really talking about was ozone and ultraviolet light. And so when I researched it, I think it was the New Jersey governor's wife, or I don't remember exactly, but had COVID, and she was doing ozone therapy along with, at the same time, they pull the blood out, send it under ultraviolet light, and infuse it back into the body. I don't do that service, but it's a common one. And I truly believe that's what he meant to say. He just messed it up and got his words all confused. But so it's a detoxification. we can say it's actually for weight loss.
Yeah.
That's the one thing that we're allowed to say because of the ultraviolet light that's in there. And basically, when you're under ultraviolet light, your metabolism increases because you're hot and you're
Hmm.
burning calories.
Hmm.
Um, but like website wise and things like that, we have to be very general about what we talk about it. It's for detoxification, it's for vitality, it's just for energy. Ozone has absolutely been shown to kill viruses, bacteria, yeast, so on and so on.
When I worked in the disaster remediation industry,
Hmm.
you would ozone a room that had fire
Right.
or smoke
Yeah.
damage, right?
Ozonation.
Yeah.
Yeah.
And so, or when the lightning strikes and that's fresh smell,
Hmm.
that's ozone going on, correct?
Smokers' cars.
Mm-hmm.
Yeah, you ozonate it. Yes, exactly. It's basically finding those particles and neutralizing it, getting rid of the smell. That's what it does. And so ozone is ozone. Ozone is O3. It's simply a molecule, and it's
Mm-hmm.
just how we're using it. And so it's super safe. Really the only contraindication of doing the ozone sauna is some people, if they have a lot of titanium replacement joints in it with the heat, we might not be as able to use the heat quite as much.
Mm-hmm.
We also combined it with something called PEMF, which is pulsed electromagnetic fields, um, which I'm a big fan of too. So you don't have to use the PEMF, but PEMF is really good for getting inflammation out of the body. It's basically low electrical current, electrical fields that believe it or not, can find the inflammation in the body. And like my trainer was using it the other day, and he's like, it always goes right to my pelvis, and that's where most of my dysfunction is. And I'm like, yeah, because that's where the electromagnetic field goes. So an electromagnetic field is really interesting because we don't want some of it because like truly, I don't know if you've ever heard of this, but some people can have like too many electronics in their house actually causing issues for them. Like I saw a really interesting case presented the other day by a doctor where her headaches, she moved into a new house and started having these excruciating headaches, and they ended up finding out it was due to her IT room, and her house was right beside her bedroom.
Mm-hmm.
And once they moved everything out, her headaches went away. And so some electromagnetic fields we don't want, some we do. Like I actually sleep on PEMF magnets, basically creating good electromagnetic fields around my bed. So some people take it as far as grounding their houses and things like that. I'm not so sure that I buy into all of that fully. I support people if they want to do it, but we do actually mix in the PEMF as well with our ozone, our Hocket ozone sauna as well.
So I don't understand why the ozone combined with the 360 core treatment. Tell me what's the connection that I'm missing there?
Um, well, so the way we're looking at it is just more of a for that person that maybe wants to come in. I, I'm making the assumption a lot of these people that are going to come in who are kind of entry level into age management medicine, they really
Mm,
don't want to necessarily do hormones because it's there are some people that they're not going to do it, and they're like, I only want non-invasive things. And so my thought is they probably haven't been in the gym for a long time. They probably are not in overall good shape. So the thought is like, instead of trying to tell them, okay, I know you're not going to do this, but let's do all hormones and peptides and let's get you in the gym 4 days a week working out with Maury in the back. Well, maybe let's ease you in. Let's start with some ozone therapy. Let's mix that with, before you do your ozone or after you do your ozone, let's do 10 minutes. The All Core 360 is 2 to 3 times a week as well. So it'd be a very easy mixture. The person would be here about 30, 35 minutes. They could do their All Core session, actually burn some calories, strengthen their core, go sit in the Hocket, do 20, 30 minutes of the Hocket, detoxify right there. And then basically kind of an entry level, age management medicine protocol without even having to get your blood drawn if you don't want to go down that path. Because
mhm.
there are people that simply they just don't want to even get their blood drawn, and that's their right if they don't want to do that.
There was a point in my life that my balance wasn't that good. I would be like a little extra attentive when I stepped off a curb or would have to kind of slip or catch myself, and not be totally confident that I was going to be able to not keep myself from going down. And I was amazed at how I deteriorated in my hips and in
Hmm.
my balance area. And then once I started working out, and totally rehabilitated that area. But I was really shocked at how I had really diminished in my ability to keep myself upright in a little situation where I was like falling almost, or stumbling up a stair.
Well, imagine how many people, because the vast majority of Americans don't exercise. So imagine how they're aging, no exercise involved, or they're exercising improperly. Your average guy just likes to go to the gym and see how much they can bench press. And that's great, but unfortunately, that's not helping our core.
Mm-mm.
And so that's why you either need to know what you're doing or have a really good trainer involved. I think trainers are worth their weight in gold. I really do. Most people, not everybody, but most people will kind of mess around in the gym, but not really do much. Whereas if you have a trainer you're paying for, you're going to be much more engaged, and especially if you have a good one. I mean, I've had three really good trainers in my life over the last 15 years, and this one I have now is the best, and he has helped me so much. I mean, I was scheduled for when I started working out, I was scheduled for low back surgery, laminectomy, and that's when I decided maybe not. Let's see about strengthening. And I was thinking about it the other day, and I used to have debilitating low back pain, sciatica. I do not think my back has hurt significant in the last couple of years. I really just can't think of when, I've actually had a backache per se in the last couple of years. And I'm now 12, 13 years older than when I used to have that back pain. And it was all from strengthening my core. We get out of whack. Like you're saying, we get weak in the pelvis. We don't realize how weak our girth muscles, our pelvis is until you really get someone that can show you that. I used to not even be able to do a decent squat probably 8 years ago. And,
Hmm.
we just didn't do them. And if I did, I didn't do them correctly. So, yeah, I agree with you. It's so important, especially as we're aging, to keep that up.
So those are some entry level ways to kind of start to explore this age management um, therapies, or there's a lot of things that most people don't realize that you have options for that don't require medications or prescriptions. What are some, so for example, ozone, or even some of the peptide treatments in where you might, there's a new one now. Tell us about the one that's now available over the counter.
Yeah, actually, in the last couple of weeks, we've had a couple of them go over the counter, and it's been really exciting. Like my own, I'm gonna call it prescription habits, even though it's a nutraceutical and you can just come pick it up.
Hmm.
My prescribing habits have picked up so much on it. I've already gone through 2 cases of the peptide in the last week. I'm actually trying to see if I'm gonna be able to get more anytime soon, because I bought 2 cases thinking it'd last a month and it lasts a week.
Wow.
Because now something that used to cost my patients $300+ now costs my patients $105,
Wow.
and it's on my shelf versus saying, Steve, I can get it to you in a week because I got to send off the prescription, I got to get it back. And it's just so that one itself is BPC 157. It's a peptide that we make in our gut. It is really, really useful for cell senescence, for inflammation in the body, really good for GI distress, GERD, irritable bowel, inflammatory bowel, really, really positive for the brain, Parkinson's, multiple sclerosis, excuse me. CTE.
What is CTE?
The traumatic encephalopathy that we're seeing now with like football players and whatnot,
Oh.
soldiers. We're even seeing it in our military, because I'm former Air Force. Just from shooting their semi-automatic rifles, hundreds of times a month, that recoil in some is actually causing closed head injuries. And so we're starting to learn more and more, because like a football player, a lot of docs don't think it's the big blow that does it. It's those micro traumas on every single tackle over and over and over. And unfortunately, we don't know why one guy is affected and another one is not. Great examples. Troy Aikman. Troy Aikman took more concussions than I think any player I know of, and he's been fine. He speaks openly about how he gets tested and he's had no issues. But then another guy who maybe never had a true concussion actually, has so many issues, and that's to be determined down the road why that is. But it's just BPC is just such a great all-around peptide. We're just so excited that now it's basically over the counter. You can only get it though through one vendor, so you have to get it through a BioT provider like myself. I can't send you down to Walgreens or one of those places to get it. The other one that has gone over the counter is DHHB, or Serene is the name that it's marketed under. And it is a really good anxiety product. And so think of it kind of like a Xanax without all the side effects, no sedation, no addiction. But for those people that can get really, I have my 16-year-old autistic son on it. Like, for whatever reason, sometimes homework just gets him all worked up. I mean, I can't do it. I can't do it. And when he gets in that mode, he's really mildly autistic. So he just gets himself worked up. And I don't know if it's placebo or if it's really working for him, but I can give him one of those, and 30 minutes later, he's calm and he finishes his homework and everything's good. And so we've been starting to use DHHB quite a bit in our practice, but now it went over the counter. And heck, a bottle of DHHB now I think is $50. And so these are really come down in price so much that, I think you and I've talked about it before. We're actually now going to like packages of peptides to basically encourage a person for not much more to pick 2 or 3 peptides versus a peptide. Trying to package them together was maybe a little bit more expensive one, but with a couple of really good, less expensive ones that work well together. And, and we're going to move to a subscription model in our practice, because we find that patients who are on subscription models just stay on task better. They stay on their peptides. If they just pay once a month automatically and it shows up, they're going to do it. But if it runs out, it's kind of like Walgreens. Not everybody always calls the number, refills the prescription, and goes and gets it. That's a little bit of a step there. I've been guilty of that before. And we're just finding that not only does the current generations like the subscription model, it's just better for compliance overall with our patients. They just comply whenever they just don't have to worry about it. Oh, here's my box. Okay, great. And so, because I'm a firm believer that most people should be on 2 or 3 peptides, not just usually one.
So for those that maybe haven't been in the previous conversations, peptides are naturally occurring amino acids that we produce.
Well, most are.
Most are.
Yeah, some are synthetic, but we have over 7,000 naturally occurring peptides in our bodies, and many of the peptides that we prescribe these days are bioidentical, made in the body. Some are synthetic, but a vast majority are bioidentical.
And so they're arranged in chains to help supplement what we used to produce at full speed, but maybe as we age, where our production diminishes.
Yes, either that, or maybe in a scenario where we just need more of that one to kind of supersaturate it and get the function. But yeah, most of the time, peptides decrease in our body just like hormones do. There have been some peptides where they see, this part of this molecule does this part of this one does this, and they can combine them together. And so those would be more of your synthetic peptides. But at the end of the day, a peptide is nothing more than chained amino acids.
So they're being arranged in certain formulas, or would that be correct?
Yeah, a recipe, a formula is nothing more than like a recipe for a cake.
There you go. So they're being studied and starting to go, oh, this recipe boosts healing in your ligaments, or like the BPC 157. It's like, wow, my IBS is like under control, and I don't feel so sore after working out.
Correct.
When I would aggravate my IBS by taking ibuprofen after a workout. And it's like, Now you can go, just who knew? Who knew that this would be an option?
Yeah, like I just talked to a patient this morning who called in. He's been a long-term patient of mine, and he's dealing with a cancer. And he's under therapy for his cancer, and he's having sciatic pain this today. And he's like, gosh, all I have to take is, because he can't take anti-inflammatories because of his kidneys, because of the cancer. And so he's like, I can't take anti-inflammatories. And he's like, I don't really want to take steroids because, the negative effect on his immune system with steroids. So we put him on BPC this morning. And I'm like, I think I have the perfect solution for you, BPC. And the cool thing about this one is his pain is kind of up and down. It's not like excruciating. So I didn't feel like the injectable BPC was necessary, which injectable is still only prescription only.
Mm-hmm.
So I said, hey, swing by the office, he got my last bottle of oral BPC today. So I was just really excited because in the old days, I would have said, well, in a week for 3 times the price, I'll get you this product, just hang with me now. And so it's just been really, really nice to be able to start carrying some of these things on our counters, on our shelves, that we can get to the patient in a much more expedient manner. But what a great option for him, and actually he's going to take some information back to his oncologist in 2 weeks. And we're going to, because I want to start him on thymosin alpha-1, which you and I have discussed before, to help modulate his immune system, to help fight his cancer. But as I tell my providers, if they're listening right now, I do recommend that you always get the oncologist on board. Even though I know, and I've convinced the patient it's not dangerous, the last thing you need is an oncologist who's not on board with new therapies. And then if that patient does go bad, they try to point the finger at you. So the good news is most of the time they'll sign off on it, but I do make the oncologist, just be aware of it. Put me one line in the note that says, I'm aware of what you're doing and I'm okay with it. And then I'll proceed with him. So he wanted me to order the thymosin alpha-1, but we're going to hold off till his oncologist gives the okay.
So you say new therapies, but actually these have been around for a long time.
Yeah, they've been around a while. They've, everything kind of starts in Europe and Australia and those type areas. And peptides are very mainstream in Europe. It's like whenever pulse wave for ED came over to America really heavily about 2.5 years ago, it was like we thought it was this, new thing when it actually been done in Europe for 15 years. So we're always kind of late to the market in the United States. And that's it's because of the FDA, and it's because, on one hand, we're trying to make sure it's safe, but I think sometimes we're actually just keeping good therapies I'm a firm believer that we should be able to educate ourselves and make our own decisions. I don't necessarily need a government entity to make those decisions for me. Now, don't get me wrong. We need governing. I'm not saying that just no holds barred, but we're a little strict in the United States. But then I saw, like, just changing subject for a second, that CDC is telling all the doctors to get ready to start giving the vaccine by November 1st, and it's still in phase 3 trials. I'm like, hang on a second, like that's not that far away. That's less than 2 months away, and so it's just kind of how the wind blows is how the FDA goes, I guess.
So we do the all core 360, maybe do the ozone treatment. What's like a great peptide that you might want to consider to start off with that would complement what I would assume someone begins that protocol or that type of therapy process, they're more inclined to want to upgrade their condition or feeling a little more athletic or robust.
Yeah, probably if someone, and I'm still assuming that this client is probably one that maybe doesn't want to get their blood drawn, that doesn't want to go that far into things. And if I'm not going to be able to get a blood draw, I'm going to probably stick with the BPC 157. But we also now have a senolytic, we've talked about cell senescence. We've got a senolytic supplement. It's not a peptide. It's just a combination of different vitamin and herbs that kind of help with slowing down cell senescence. I wouldn't say it's as good as a peptide, but it's a nice entry level. Hey, doc, help me out. I don't want to spend a ton of money. I don't want to get too deep into this, but my thought is that that person's going to eventually probably do that for a month or two. They're going to see the advantages of it, and they're probably going to say, well, what's the next step? And so that's how I see this, as just an entry level. Now, don't get me wrong. A lot of my ozone patients currently are current patients who are doing all kinds of services, and they're
Right.
mixing in the ozone as, adjunct to their other services. But I'm just, the combination of the all core and the ozone is just kind of our thought of for those very, very entry level patients, because we do get a lot of calls of like, hey, what can I do that's not too aggressive? But we're also really excited this week. We're starting to unroll a new wellness program that we came up with this week, that we're just combining some things, because the one thing we really struggle with in our practice is how to get someone into our practice
Hmm.
and where to start with them. Like, we have the concierge services, but then we also have plain hormone services.
Hmm.
And, some people don't have high blood pressure, high cholesterol. They don't have a real high risk for heart disease. They just want to get their testosterone. They want to move on with their day. So they obviously don't want to pay the same fee that a concierge patient pays. So I'm going to be rolling out a program next week that's going to be for that person that maybe just doesn't know which route they want to go. And we're going to be offering the true age DNA test that we've talked about, that gives you your actual true biologic age, combined with a much larger panel. It's actually my concierge lab panel that I do on my new concierges and my concierge patients get annually, combined with an evaluation with myself, for about an hour evaluation, and also having them get a CT calcium scoring done at the radiology center before they come in, that screens for heart disease. So, like, I talked to a guy today that he'll pay $1,000 plus $125 to the radiology center for the CT calcium scoring, but he's going to get a DNA test. He's going to get a huge lab panel, and he's going to get at least an hour of my time. And then at the end of that hour, then we can decide what route is best for that patient. Maybe Bill is actually in really good shape. Maybe he needs nothing. Maybe I just got to give him some exercise tips and some nutrition tips and say, come back in a year and we'll do this again. Maybe I say, your only real problem is low testosterone. Let's move you over to that program because we have a monthly membership for testosterone patients. Or, you know what, we found a lot of stuff today, and if you want me to address it, we're going to have to go concierge because we're going to have to spend some time on this. Then they can go down that path for a monthly fee. And so we're just really excited. I think it makes a lot of sense for our patients. And so we've just been kind of struggling with that a bit on, some patients have a really hard time figuring out where they want to go. Some patients know. They call and say, I just want to get my testosterone looked at. Okay, great. So we just think it's going to be really popular. So we're just excited to unveil that next week.
What I found was, you go through life and you have all these things you hear, cancer this and spinach that, and so the problem with wanting to improve maybe how you eat or the way you treat yourself is actually you're just guessing and you're kind of in the dark. And so to do that deep lab panel and to actually figure out where your baseline is and what really needs to be worked on and what you can start moving toward, that I found that really empowering, or at least it gave me more confidence in that what I was going to do was actually going to benefit. We'd be able to measure the impact of it, and I think that's really cool what you're offering.
Yeah, because as you and I have talked about before, the true age epigenomic testing that gives us our biologic age is using over 800,000 DNA snippets, and before that, we were using just a couple thousand snippets to come up with your biologic age, and you can see a change in your biologic age in the positive in just 6 months to a year. And so now we have such great objective data that we can show these guys and girls of how they're aging, either gracefully or not so gracefully. And then we can implement a real plan that someone can live by, that's not so difficult that they can't do it. And then we can retest in 6 months or a year and say, look at this. You actually reversed a year this year in age. And I just think that's really cool now that we have this ability. And who knows what we're going to have in the next 5 years. I mean, this stuff is changing so rapidly. It's a chore just trying to stay on top of it all right now. But it's really great stuff. It's a really cool time to be a physician if you really want to be into prevention. I feel like my biggest thing that I'm into is prevention. I think my local cardiologist would agree with that on me, because we have found a lot of heart disease in the last few months to a year from just being ultra aggressive with labs, CAT scans, risk factor modifications. It's so important to stay on top of all this stuff.
When you say biologic age, what does that really mean? Is that like my true age?
Yeah, so that's actually why they call it the true age test, because your chronologic age is your date of birth. Okay, I'm
Mm-hmm.
chronologically 48 years and 3 months. Okay,
Mm-hmm.
I may be biologically 52 years and 8 months. And so your biologic age is your true age, which is totally different than your chronologic age. And so it's just really cool to look at that, because some people think they're in really good shape. And then you get their biologic age back and go, Like, I had a guy the other day, he was 3 years older than his chronologic age. And, that was kind of eye opening for him. Like, I mean, I'm 50, but I'm 53 biologically. Like, yeah, that's what that means. Or if you're doing everything right and you're 53 chronologically, but you're 50 biologically, then that reinforces, hey, I'm going down the right path. But what a cool way now that we can start a person on nutrition, exercise, peptides, and hormones, or whatever combination of those things, and then retest in a year and show a person they got younger. I
Mm-hmm.
mean, how cool is that? And so, I mean, I think I told you the other day they did a 60-day DNA testing just with intermittent fasting and showed a reduction in age just by doing intermittent fasting. And so, what a cool way to start telling patients, like, look, you've been looking for a reason to do intermittent fasting. Here it is. It's reducing the stress on your body. It's reducing your age. And so, I know for me, I already believed in intermittent fasting. It just cemented it for me. I'm like, okay, I was already sold, but I'm really sold now.
So what are the things that are impacting your biologic age? I mean, maybe you've been exercising, so you think, all right,
Everything.
everything, but maybe you feel like you've been exercising, your heart's good, my breathing rate's good, my recovery rate's good.
Yeah.
What are some of the things that you're missing or not realizing?
So the cool thing about the True Age is they actually, per your DNA, can give you some good ideas of maybe what's causing your problems. So they don't just give you like a general, like, eat better, exercise more, yada yada yada. They actually can tell from your DNA, possibly with a fairly high positive rate, of what's causing your problems. But what causes rapid aging is cell senescence, which
Hmm.
is caused by lots of things. But genetics is one thing that we really can't do anything about right now. Some
Right.
people just are dealt a bad card or a good card, and that's unfortunate for the bad ones and good for the good ones. Alcohol use, one of the most common things in my practice, excessive alcohol use. I'm surprised how many people think that 6 drinks a night is not that much. So 2 drinks a day is considered good. Anything over that is not. And the problem is with people who drink 2 drinks every day is that usually comes 3 or 4 at some point, and before you know it, they got a problem. Lack of
Hmm.
sleep, excessive stress, poor diet, lack of intermittent fasting, lack of proper exercise, maybe lack of not enough exercise. Uh, it just, the list goes on and on. But the most common things that, like, my most common patient with this kind of stuff is males. And it's usually stress from work, lack of sleep, alcohol use, tobacco use, lack of exercise, not necessarily exercising improperly, just not doing it,
Right.
and just bad nutrition. And the good thing is most people will forget peptides, forget hormones. Gosh, just diet and exercise. It's an amazing healer. If that's all my patients would do, my patients overall would be really, really happy. But eating right and exercising is probably the hardest thing to get a patient to do.
I'm amazed at. So, I do intermittent fasting some,
Mhm.
and I'll tell someone I'm doing it, And it's like there's this big thing is like, oh, I don't think I could do that. I don't think I could
Yeah.
go
Right.
that. And really that's not true. You can, but it's
You
more
can.
you've convinced yourself you can't. And
Mhm.
and yet if they knew that just the impact of the cell senescence, getting rid of the zombie cells,
Right.
if I but if you took a test and said, "Oh my gosh, Steve, you've got 60% zombie cells. Well,
Yeah.
what should I do?" Well,
Right.
just go without eating a little bit. Okay, I'm on it. And
Yeah.
that, but I don't think they're looking at it right, or they convince themselves that that's just a hurdle they can't get past.
Yeah. I do. Meet that head on a lot every week. And here's what I tell those patients is for the only time I tell patients not to intermittent fast is if they're insulin using diabetics. Okay. Or if they're on diabetic medicines, sometimes we might have to rotate their timing of their diabetic medicines. That's really it. Everybody else I think can do it. It's about convincing yourself you can do it. And then just saying, okay, give me as many hours as you can give me and then eat. Don't torture yourself. This isn't meant to be brutal. Take 2 to 4 weeks to get to, because mine is 16 plus hours is what I recommend. And so maybe you only make it to 13 and a half. We can all do 12 or 13 in our sleep. I mean, that's no big deal. Okay.
Hmm.
And so it's just slowly ratcheting it up. It's just breaking bad habits. So many people, they fail themselves before they even have a chance to fail. They've given up before they even try. You know what I mean? And they're just like,
Yeah.
oh, I can't do that. I can't do that. Yes, you can. And I can't tell how many times patients come back and like, I could do it. And I'm like, of course you can. You don't have to eat breakfast. Okay. Mom wasn't right about it was the most important meal of the day. I'm sorry, Mom. You're not right on that one. Okay. And so, anyway, unless your fast is over, then fine. It's the most important meal of the day. Just get those 16 hours a day in at least 3 to 5 times a week. It makes a huge difference in your immune system, your metabolism, your fat burning ability. The only bad thing I can say about intermittent fasting for myself is it sometimes makes me get a little lazy with my diet because I realized that it's kind of like when I started testosterone, I realized I could not eat quite as clean, but not gain weight because I was on testosterone.
Hmm.
Intermittent fasting has had that effect on me at times as well. Like, maybe I can, I'll just intermittent fast tomorrow. Or, hey, tomorrow I'll do a 22-hour fast because I do try to do a 22-hour fast every 2 to 4 weeks, just an extended fast just for immune system modulation. And so, because I do believe, I always talk about immune system, but I believe it's the most important system in our body, our immune system. So, anyway, but yes, everybody can intermittent fast. My sugar will get too low. Okay, come on now. That's very few people are truly hypoglycemic. It's just that feeling they get, and they can't fight through it, and they go grab a Snickers bar.
So at the end of the day, let's say you ate dinner at 7:30 or whatever, and you wrap it up at 8. You have a one more glass of wine or something. Did you stop eating at 8, or did you stop eating after that glass of wine? Or
Glass of wine, whatever that last calorie hits your lips is whenever your intermittent fast starts. And so, like, I'll give you an example. My wife Crescenta, she intermittent fasts most of the time, but she is a chocoholic, but she eats little tiny bits of chocolate. I mean, I've never seen a person make a chocolate bar last a month. So she's not by any means, she's a tiny girl. She doesn't excessively eat it, but I saw her in the refrigerator eating this little bitty piece of chocolate at like 10:30 the other night. And I go, now your intermittent fast now has to go to 2:30 tomorrow. And she's like, shut up. And she just walks away because she talks about me trying to keep her accountable to intermittent fasting. And so so she didn't eat from 8 to 10:30, but she went and had that bite of chocolate. So now it's 16 hours from that moment in time. So
Mhm.
what I also find is it just really helps with people from nighttime snacking.
Yeah.
And it makes such a huge difference because most guys, where they do their biggest damage is from dinner to bed. They're bored. They're watching the football game or the basketball game and like, oh, cookies. And, they go grab 3 cookies and munch on them. And you'd be amazed at how many bad calories they put in from supper to bed. And if you're fasting, guess what? Stops that. You're not doing that anymore. And that helps a lot as well.
So you want to do that, and we'll wrap this up. But so ending your meals at a certain time, plus overnight while you sleep, is like that's when you're really burning fat. Is when you're sleeping. Is that what I'm
Well, so
understanding?
yeah, your growth hormone does most of its heavy lifting while you're asleep. And the reason that it does that is because insulin kind of counteracts growth hormone. And so, like I tell guys, the worst thing you can do is eat 2 cookies and go to bed, because you're going to have a sugar dump and you're going to have an insulin spike. And now that insulin spike is going to counteract your growth hormones levels. And then your growth hormone can't do its thing, which is working on your metabolism plus healing and anti-inflammation and things of that nature. So intermittent fasting, how it works is basically, if you have no true calorie intake, then your insulin levels are going to drop to its lowest point of the day for an extended period of time, causing your body to metabolism to ramp up, but also to start pulling fat cells for fuel. And most of us all have a few fat cells that need to be used up, lowering your chance of insulin resistance, body composition gets better, immunity goes up. And so that's kind of your whole, like in a thumbnail sketch, the reason why we want to do intermittent fasting.
So if the providers that are listening to this, they've been listening to some of these conversations, and they want to really kind of start adding some of these things to their practice to offer their patients other options besides medications or a typical insurance regulated solutions. How can they reach you or talk to you?
Yeah, so the easiest way is just to email me, Dr. Kris with a K, so DRKRIS at theresurgeclinic.com. And another cool thing we've added in the last couple of weeks is I am a lecturer, and I help lead the program for peptides with BioT, the bioidentical hormone pelleting company. I'm also a mentor with them now as well. So any physicians that have interest in that, I can actually be their mentor for their education process with that. So that's something we finally got signed off of legally in the last couple of weeks. So that's another cool addition to it. But I just like to spread the word about this stuff, and I'd love to help other practitioners in any way I can, because this field needs many, many more of us leading the charge. It has a long ways to go to be saturated. So I just want to try to educate other physicians and providers on how to help their patients in a different manner.
Yeah, if you're listening and you think your doctor needs to know about it, this would be a great way to introduce your doctor to this kind of knowledge that you learned, and maybe they can use you on some of these initial treatments that if you're close enough with your provider.
Absolutely.
All right, Dr. Kris, thank you again. This is excellent. Thanks everyone for being on our very first live stream. We'll be doing this every week, so stay tuned. And that's it. Thank you. Thanks, Dr. Kris.
Thanks, Steve.